Hello, Professor. So today I'm going to talk to you about the care plan that I have for my patient, William Johnston. So because he has some periodontal pockets that are deeper than we would like, I decided that the bass brushing method would be the best for him because of the gingival stimulation effect that it has. So if I was to have William in my chair, first thing I would do would be ask him to show me how he brushes on the Typodont. And if it's anything but the bass method, then I would explain to him that I think that the bass brushing method would be best for him with the issues that he has going on. So I'm going to show you the bass brushing method, and then for him I would have him regular floss, just he needs to take a little bit more time with it. And then one of his needs was that his hands were too big to get all of the areas in his mouth. So I recommended a floss aid like this. And this isn't the specific one that I recommended for him. I recommended the Listerine with the longer handle, but I don't have one of those with me today. So I'm going to show you using this one, and I would be very specific, teaching him that he needs to wash it and all that, but I'll go over that later. And then also I would recommend Super Floss for him. So because he does have some bigger spaces, and a bridge with the Super Floss would be nice to use under. So I'm going to show you the bass brushing method first. So I would start off by showing him on, probably on the upper. I would explain this 45-degree angle here. It needs to be kept. And then I would show him the vibratory jiggle motion. It's kind of hard to see. All the way around. And I would really make sure to emphasize with him that this is really important in getting his gums involved with brushing, because he has some gingivitis, or what I believe to be gingivitis, and puffy bleeding gums. So I think that this brushing method would really do him some good. So I'm going to continue. So I'll show you on the lowers, the vibratory jiggle. Keep the 45-degree angle. Kind of a horizontal jiggle as well, and really get the gums involved. So that is the bass brushing method. And then now I would recommend showing him the proper length of floss, explaining the importance of wrapping a new piece of floss every time he goes to a new tooth, because that's very important to not spread the bacteria. And because he does have some inflammation, this is really important. So first thing you want to do, wrap it around your dominant hand, middle finger a couple of times. Loosely wrap it around the non-dominant hand. And make this a little bit closer. And we want to make, using our two pointer fingers, we really want to make, trying to get closer, the C shape here. And we want to move, after we get into the contact, we want to move up and down, really maintaining that C shape. And then when we move on to the next tooth, we want to get a new piece of floss, seesaw in there. Make a C shape, hope you can see, and go up and down. Make sure to get underneath the gums, and that side as well, and so on. So I'll show you again on this tooth. Really want to keep that C shape there, and go up and down, and up and down on that side. obviously it would be easier if I could hold the Typodont still. And then for him, I would show him how to reach the posterior teeth with a floss aid like this. I know they're not usually recommended because they do spread bacteria, but I would just really, for him, I think what's important is that he gets floss in there. So these, they're not ideal, but just to kind of get him started, I would really recommend something like this. And I would just really hit the point home that he needs to wash it after every tooth, and he needs to either dispose of them or change the head out really frequently. So, and these work similarly. You really want to seesaw them in there. Then after you get it in there, do the best you can, going up and down on this side, up and down on that side, and then wash it off, move to the next tooth. Seesaw in there. And obviously this is not ideal because you can't really get that C shape that you want. But again, if it's just for those back two molars, or maybe just the in between the second and the third molar, he doesn't have third molars, but for something like that, just to get that extra floss back there, I think that would be good for him. And then again, with him, I really emphasize just, he does floss, I just want him to be a little bit better at flossing. So for a later appointment, not initially, I don't want to bombard him with too much stuff, but I would introduce him to some Super Floss, which I have here, which my sister uses for her braces, but I think this would really benefit him because after he gets his normal routine down, I think incorporating Super Floss for him would be really awesome because he does have a big diastema on the mandible in between number 21 and 22, and I think that some Super Floss would be really nice for him to get in there and really get around, get in that diastema. And then again, he also has a bridge, which I can't demonstrate, but he has a bridge on the upper right side, and I think to show him, maybe on himself, it would be really beneficial for him to get the Super Floss up underneath that bridge before too many problems start to occur there. So those are the few suggestions that I had for him, OHI wise. I also think incorporating some Listerine would be really helpful for him. I say Listerine just because I like the Listerine Zero. It kills germs, and he's showing some signs of gingivitis and the deeper pockets. I think that he could really benefit from a mouthwash because he doesn't currently use one. So maybe even some medicated mouthwash. But just to start off, I suggested just some maybe Listerine Zero that's not as intense. I don't know. Obviously, I don't know how he would feel about that, but when it's a real patient, that would be something I would be able to gauge a little bit better. Does he like the intensity of Listerine, or would Zero be better for him, or something like that? So that's all that I have today for Mr. Johnston.